Welcome to our presentation on psoriatic arthritis, an intricate blend of rheumatoid and osteoarthritis. Psoriatic arthritis is a complex condition that combines elements of both rheumatoid arthritis and osteoarthritis, presenting unique challenges in diagnosis and management. Let's explore the multifaceted nature of psoriatic arthritis and delve into its clinical features, pathogenesis, and therapeutic approaches. Welcome to our discussion on understanding the unique characteristics of psoriatic arthritis. Psoriatic arthritis shares several similarities with rheumatoid arthritis, notably the hallmark of chronic inflammation that leads to joint swelling, pain, and stiffness. However, there are distinct differences that set psoriatic arthritis apart from rheumatoid arthritis and other forms of arthritis. One notable difference is the pattern of joint involvement. While rheumatoid arthritis typically affects joints symmetrically, psoriatic arthritis tends to exhibit an asymmetrical pattern of joint involvement, more akin to osteoarthritis. Additionally, psoriatic arthritis can compromise the distal interphalangeal (DIP) joints, which is a hallmark feature of osteoarthritis, alongside other joint manifestations seen in rheumatoid arthritis. Another intriguing aspect of psoriatic arthritis is its potential to exhibit both rheumatoid factor and anti-CCP antibodies, blurring the lines between these two conditions. This unique immunological profile adds complexity to the diagnosis and management of psoriatic arthritis, highlighting the need for a comprehensive understanding of its characteristics. By exploring these unique features, we can better differentiate psoriatic arthritis from other arthritic conditions and tailor our approach to diagnosis and treatment accordingly. Let's take a deeper look into these aspects as we continue our discussion. Let's explore the exclusive signs and symptoms of psoriatic arthritis, distinguishing it from other forms of arthritis. One unique feature is dactylitis, colloquially termed sausage digits, which refers to inflammation affecting the entire digit, whether it's a finger or toe. This distinctive symptom is characteristic of psoriatic arthritis. In severe cases, psoriatic arthritis can lead to significant joint deformity and disability, underscoring the importance of early diagnosis and intervention. Nail changes are another hallmark of psoriatic arthritis, including painless detachment, onycholysis, and pitting. These manifestations are not commonly observed in other types of arthritis. Hyperkeratosis, the thickening and hardening of the skin, is a common skin manifestation associated with psoriatic arthritis, further highlighting the diverse clinical presentation of this condition. Understanding these exclusive signs and symptoms is crucial for accurate diagnosis and timely intervention in the management of psoriatic arthritis. Let's explore further into its complexities and implications. Now, let's outline the stepwise therapeutic approach for managing psoriatic arthritis. For milder cases, treatment typically begins with non-steroidal anti-inflammatory drugs, NSAIDs. These medications help alleviate pain and inflammation, providing relief for patients with less severe symptoms. As the disease progresses to moderate severity, the treatment regimen advances to include a combination of NSAIDs and disease-modifying anti-rheumatic drugs, DMARDs. DMARDs are crucial for addressing the chronic inflammatory component of psoriatic arthritis and slowing disease progression. In cases of severe psoriatic arthritis, characterized by significant joint damage and functional impairment, the treatment plan becomes more aggressive. Alongside NSAIDs and DMARDs, there's a particular emphasis on the use of tumor necrosis factor, TNF inhibitors. These biologic agents target the aggressive, erosive nature of the disease, aiming to halt further joint destruction and improve patient outcomes. By following this stepwise approach, healthcare providers can tailor treatment strategies to the individual needs and disease severity of patients with psoriatic arthritis, optimizing outcomes and enhancing quality of life. Now let's discuss the role of steroids in managing psoriatic arthritis. Unlike in psoriasis, where topical steroid creams are commonly used, it's crucial to avoid the use of oral or injectable steroids in psoriatic arthritis. Why? because ongoing steroid therapy or sudden withdrawal can actually trigger the development of a severe pustular form of psoriasis, worsening the patient's condition. The delicate balance of managing psoriatic arthritis means that while steroid therapy may be beneficial in other forms of inflammatory arthritis, it can have detrimental effects on the underlying psoriasis condition in this context. To avoid steroid-induced flare-ups and complications, the treatment approach for psoriatic arthritis focuses instead on alternative therapies. Specifically, we prioritize the use of disease-modifying anti-rheumatic drugs, DMARDs, including TNF inhibitors. These medications effectively manage the inflammatory component of the disease without posing the risks associated with steroid use. By steering clear of steroids and opting for safer, more targeted therapies, we can ensure better outcomes and improved quality of life for patients with psoriatic arthritis. Now let's underscore the importance of early and aggressive treatment in psoriatic arthritis. In psoriatic arthritis, timely intervention with disease-modifying anti-rheumatic drugs, DMARDs, and biologic therapies is crucial. Why? Because it helps halt the progression of joint damage and prevents long-term disability. By addressing the underlying inflammation early on, we can preserve joint function and mobility, ultimately improving the prognosis for patients. Furthermore, effective management of psoriatic arthritis goes beyond just relieving joint pain. It can significantly enhance patients' quality of life by reducing swelling and functional limitations. By managing symptoms effectively, we empower patients to lead more active and fulfilling lives. It's also important to recognize that psoriatic arthritis is associated with an increased risk of comorbidities, such as cardiovascular disease and metabolic disorders. This underscores the urgency of early aggressive treatment. By managing the inflammatory process effectively, we can not only alleviate joint symptoms, but also mitigate the risk of developing these serious complications. In summary, early and aggressive treatment is paramount in psoriatic arthritis, offering not only symptom relief, but also long-term benefits in terms of preserving joint function and reducing the risk of associated comorbidities. Now let's consider the multidisciplinary approach to managing psoriatic arthritis. First and foremost, the rheumatologist plays a central role in the management of psoriatic arthritis. They are responsible for initiating and monitoring appropriate treatment strategies, which may include medications like DMARDs and biologic therapies. Regular monitoring by a rheumatologist is crucial for assessing disease activity and adjusting treatment as needed to achieve optimal outcomes. Next, we have the dermatologist, who plays a vital role in managing the skin manifestations of psoriasis. Given the close association between psoriasis and psoriatic arthritis, effective management of skin lesions is essential for controlling the arthritic component of the disease. Dermatologists can prescribe topical treatments, phototherapy, or systemic medications to manage psoriasis symptoms effectively. Physical therapy is another integral component of the multidisciplinary approach to managing psoriatic arthritis. Physical therapists can design personalized exercise programs aimed at maintaining joint function, improving range of motion, and strengthening muscles. These interventions not only help alleviate pain and stiffness, but also enhance overall mobility and quality of life for patients. Lastly, a nutritionist can provide valuable guidance on dietary modifications that may benefit patients with psoriatic arthritis. An anti-inflammatory diet rich in fruits, vegetables, whole grains, and healthy fats can help reduce inflammation and improve symptoms. Additionally, weight management is important, as excess weight can exacerbate joint pain and increase the risk of complications. A nutritionist can work with patients to develop a personalized nutrition plan that supports their overall health and well-being. In summary, a multidisciplinary approach involving rheumatologists, dermatologists, physical therapists, and nutritionists is essential for effectively managing psoriatic arthritis. By working together, healthcare professionals can address the diverse needs of patients and optimize their treatment outcomes. Now, let's discuss the evolving landscape of psoriatic arthritis management. With the advent of targeted biologic drugs, such as TNF inhibitors, there has been a significant shift in the treatment paradigm for psoriatic arthritis. These biologic therapies have revolutionized the management of the condition, offering more effective and safer treatment options compared to traditional medications. By specifically targeting key inflammatory pathways, biologics can help control symptoms, reduce joint damage, and improve quality of life for patients with psoriatic arthritis. Furthermore, as our understanding of psoriatic arthritis continues to advance, the treatment approach is becoming increasingly personalized. Healthcare providers now consider individual patient characteristics, disease severity, and specific manifestations when determining the most appropriate treatment plan. This personalized approach ensures that patients receive tailored interventions that address their unique needs and preferences, leading to better outcomes and improved patient satisfaction. In addition to targeted biologics, the use of combination therapy has emerged as a promising strategy for managing psoriatic arthritis. By combining disease-modifying anti-rheumatic drugs, DMARDs, with biologic agents, clinicians can achieve better disease control and improve long-term outcomes for patients. This approach may be particularly beneficial for individuals with more aggressive forms of the disease or those who have not responded adequately to monotherapy. Overall, the landscape of psoriatic arthritis management is continually evolving, driven by advancements in our understanding of the disease and the development of innovative treatment strategies. By embracing these changes and adopting a personalized multidisciplinary approach, we can optimize care and improve outcomes for patients with psoriatic arthritis.